Good afternoon. This is All India Radio. I am Anuja Kumar and with me is Prashant Kumar Sinha with the Midday News. The headlines. 4 new interministerial central teams reach Hyderabad, Chennai, Ahmedabad and Surat to make on-the-spot assessment of COVID-19 situation. Government allows reopening of all shops excluding malls in non-hotspot areas. Government declares banking industry as public utility service till 21st of October. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. Sanjay Kothari takes over as Central Vigilance Commissioner. First day of holy month of Ramzan observed all over the country. Inter-ministerial central teams have reached Ahmedabad and Surat today. Both the cities have reported the maximum number of COVID-19 cases in the state. The team, headed by an additional secretary-level officer, is holding the talks with the district collector, police commissioner and other higher officials from the state government in Ahmedabad. The team is also likely to visit the old walled city area, which has emerged as the major hotspot of COVID-19 in the city. AIR correspondent reports that out of the total 33 districts, as many as 30 districts of Gujarat have been affected due to COVID-19. Only 3 districts, namely Amreli, Junagadh and Devbhoomi Dwarka, have been unaffected by coronavirus so far. The health department said there is no need to panic, but we need to cooperate with the police and the government as the fight is long. An interministerial central team IMCT has begun taking stock of COVID-19 situation in Hyderabad. The team visited Gachibowli Telangana Institute of Medical Sciences and Research Hospital as part of its efforts to assess the preparedness of the health sector in combating COVID-19 in Hyderabad. They went around the facility and gathered details from the state health department officials. The 5-member IMCT, led by Additional Secretary, Ministry of Jal Shakti, Arun Baroka, arrived earlier by a special flight in Hyderabad from Delhi. The members include Senior Public Health Specialist Dr. Chandrasekhar, NIN Director Dr. Hemlata, Director Consumer Affairs S.S. Thakur, and NIDM Associate Professor Shekhar Chaturvedi. The IMCT will also be visiting some other facilities in Hyderabad and interact with the health officials, health minister and other top officials during the day. The central team is visiting Hyderabad a day after Ministry of Home Affairs constituted 4 IMCTs to visit Hyderabad, Ahmedabad, Surat, Chennai and Thane.
The Inter-Ministerial Central Team to assess the ground situation of COVID-19 in Tamil Nadu has met the Chief Secretary and higher officials in the Secretariat in Chennai this morning. Meanwhile, the state government has declared full curfew for Chennai, Madurai and Coimbatore corporations for 4 days starting tomorrow morning. Salem and Tirupur corporations will undergo the full curfew for 3 days starting Sunday. More from our correspondent.
The maximum COVID-19 caseload in Tamil Nadu is in Chennai. Therefore, the central team comprised of Dr. Anita Kukkar, Dr. Surya Prakash, Dr. Lokendra Singh and Dr. Vijayan is assessing the ground realities in the city today. They reached Chennai by a special aircraft last night and reviewed the situation with the Chief Secretary and other senior officials this morning. Later, they held a comprehensive discussion with the city corporation officials about the ongoing efforts to contain the disease spread, the capacity expansion for testing and treatment and relief efforts. In the afternoon, they are planning to visit the exclusive COVID-19 treatment facility in the city. Full-scale lockdown for 4 days comes into effect in Chennai, Coimbatore and Madurai, and Tirupur and Salem will face the complete shutdown for 3 days from tomorrow morning. People could be seen forming long queues before vegetable and meat stalls in Chennai today to stock up the things sufficiently. Jai Singh, AR News, Chennai.
In a reprieve to the public at large, the government has permitted registered neighbourhood and standalone shops to open from today onwards amid the coronavirus lockdown. However, market complexes within the limits of municipal corporations and municipalities will not open. The exemption has also not been given to shops in marketplaces, multi-brand and single-brand malls located in municipality areas, coronavirus hotspots and containment areas. The Home Ministry today clarified that all shops in rural areas, except those in shopping malls, are allowed to open. In urban areas, all standalone and neighborhood shops and shops in residential complexes are allowed to open. More in this report.
Shops in market complexes and shopping malls are not allowed to open. Home Ministry in its clarification further said, sale by e-commerce companies will continue to be permitted for essential goods only. Sale of liquor and other items continues to be prohibited as specified in the National Directives for COVID-19 Management. No shops will be permitted to open in hotspots and containment zones. Amending its April 15 order, the Home Ministry said the shops will mandatorily have 50% strength of workers wearing masks and following social distancing. The opening of neighborhood shops is being seen as a relief to people who have been under lockdown since 24th of March to contain the spread of novel coronavirus. The Home Ministry order came on the eve of Muslim holy month Ramzan. With Suparna Saikia, Anupam Mishra, AR News, Delhi.
Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio tomorrow. It will be the 64th episode of the monthly radio program. It will be broadcast on the entire network of AIR and Doordarshan and also on AIR News website www.newsonair.com and News on AIR mobile app. It will also be streamed live on the YouTube channels of AIR, DD News, PMO and Information and Broadcasting Ministry. AIR will broadcast the program in regional languages immediately after the Hindi broadcast. The regional language versions will also be repeated at 8 in the evening. The government has declared banking industry as a public utility service for 6 months till October 21st under the provisions of the Industrial Disputes Act. Bringing banking services under the provisions of this act means that the banking sector would not see any strikes by employees or officers during the operation of the law starting from April 21st. In a circular, Department of Financial Services said the Labour and Employment Ministry through a notification has declared banking industry as a public utility service for 6 months. The notification was issued by the Labour Ministry against the backdrop of the coronavirus pandemic, which has significantly impacted economic activities.
External Affairs Minister Dr. S. Jaishankar spoke to his counterparts from Qatar, the UAE, Niger, Palestine and the Czech Republic yesterday and held discussions on the coronavirus infection. In conversation with Qatar Foreign Minister Mohammed bin Abdul Rahman Al Thani, Dr. Jaishankar discussed their experience of dealing with the coronavirus infection and also thanked him for taking care of the Indian community. He said such challenging times will only further strengthen the friendship between the two nations. The minister also spoke to United Arab Emirates Foreign Minister Sheikh Abdullah bin Zayed. Later in a tweet he said, pandemics further highlight the need for international cooperation. He applauded the generosity of the spirit and clarity of policy that has characterized the UAE's approach towards COVID-19. Dr. Jaishankar also spoke to Niger Foreign Minister Kala Ankurau and assured him of India's support in meeting the coronavirus challenge, including medicines. He also discussed the coronavirus situation with Palestine Foreign Minister Raed Al-Malki and assured him of Indian medical assistance. He also exchanged experiences on coronavirus response with Czech Foreign Minister Thomas Petrajsek. The minister said the two leaders agreed that there are valuable lessons for international cooperation. The government is taking several measures to facilitate farmers and farming activities at the field level during the lockdown period. More than 150,000 farmers and traders have registered themselves on the Kisan Rath mobile app since its launch. The Kisan Rath app facilitates farmers and traders in identifying the right mode of transportation for movement of farm produce ranging across food grain, fruits and vegetables, flowers, bamboo and coconuts. Over 80,000 farmers and 70,000 traders are registered on this app till date.
Department of Posts will deliver essential items through National Road Transport Network with 22 routes of over 500 kilometers. This initiative will give a fillip to the movement of essential items within the country, as Department of Posts is capable of delivering parcels carrying essential items anywhere in the country. A report.
Due to the lockdown arising out of COVID-19, the supply chain management of essential items in the country got disrupted as the passenger airlines, railways and state roadways stopped plying. Communications Minister Ravi Shankar Prasad had encouraged Department of Posts to think out of the box in the crisis period. As a result of this, the idea of starting a road network with the existing fleet of departmental vehicles primarily used for intra-city delivery was conceived. Department of Posts has already taken a number of initiatives to ensure supplies of essential items including medicines, COVID-19 testing kits, masks, sanitizers, PPEs and medical equipment to all corners of the country. It has also been delivering cash at doorsteps, especially of old Divyangjan pensioners through Aadhaar-enabled payment system. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
The Centre has asked the states and the Union Territories to ensure that the diagnosis and treatment of TB patients go uninterrupted during the COVID-19 pandemic situation. The Health Ministry has also asked to ensure that all the facilities under National TB Elimination Programme remain fully functional. The Ministry said if the TB patient is unable to approach the health facility, arrangements should be made to deliver drugs at the doorstep of the patient. States and UTs have to ensure that patients with or without ID receive medicines at a health facility. The Health Ministry said the TB diagnostic and treatment services are fully operational. TB patients are being advised about the precautions to protect themselves from COVID-19 and to continue their TB treatment as prescribed. The Ministry said health of the patient and healthcare workers remain the top priority during COVID-19 pandemic situation.
The Indian Council of Medical Research ICMR has said that 5,79,951 samples of COVID-19 have been tested by the various government and private laboratories in the country. Meanwhile, ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 272 government laboratories and 87 private laboratories chains have been given approval to conduct the test for COVID-19. The country's foreign exchange reserves surged by $3.09 billion to $479.57 billion due to an increase in foreign currency assets. According to the RBI, in the week ended 17th of April, foreign currency assets, a major component of the overall reserves, rose $1.55 billion to $441.88 billion. Gold reserves increased by $1.54 billion to $32.68 billion, while special drawing rights with the International Monetary Fund were up by $3 million to $1.43 billion. The country's reserve position with the IMF remains stable at $3.58 billion. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. 4 new interministerial central teams reach Hyderabad, Chennai, Ahmedabad and Surat to make on-the-spot assessment of COVID-19 situation. Government allows reopening of all shops excluding malls in non-hotspot areas. Government declares banking industry as a public utility service till the 21st of October. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. Sanjay Kothari takes over as Central Vigilance Commissioner. First day of the holy month of Ramzan observed all over the country. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alert.
Senior IAS officer Sanjay Kothari takes oath as the Chief Vigilance Commissioner. President Ramnath Kovind today administered him the oath at Rashtrapati Bhavan. Prime Minister Narendra Modi, Vice President Venkaiah Naidu and others were also present at the ceremony. Social distancing was strictly followed at the ceremony. The first day of holy month of Ramzan is being observed across the country. Shahi Imam of Delhi's Jama Masjid announced the sighting of the moon last evening. The worshippers offered special daily night prayers called Taraweeh at their homes last night in compliance with the nationwide lockdown norms amid COVID-19 pandemic. Several Muslim clerics, leaders, scholars and religious organizations have already appealed to Muslims to offer prayers and other religion rituals during holy month of Ramzan, staying inside their homes, adhering to social distancing. Ramzan is the 9th month of Islamic calendar and Eid ul-Fitr is celebrated at the culmination of this month.
The holy month of Ramzan has begun in Telangana and Andhra Pradesh following the sighting of the crescent in many parts of the country, with the Central Ru'yat-e-Hilal Committee announcing the beginning of the holy month of Ramzan. The observation of the first Roza began today. The religious ulema met at Khankah-e-Kshatriya, Dabirpura in Hyderabad last evening, and Majlis Ulema-e-Dakkan President Syed Muhammad Kubul Pasha, Qadri Shatari, and Jamia Nizamiya Vice-Chancellor Maulana Mufti Khalil Ahmed gave the official declaration of beginning of the holy month of Ramzan. More from our Hyderabad correspondent.
The religious ulema said the moon was not sighted in Hyderabad due to cloudy weather, but they received confirmed reports of sighting of crescent moon from Karimnagar in Telangana, Vijayawada and Guntur in Andhra Pradesh, besides some parts of other states. Amidst the national lockdown in view of the coronavirus pandemic, a fatwa has been issued by the Jamia Nizamiya, the Islamic Seminary of Hyderabad, asking the worshippers to perform Taraweeh at their respective homes. The fatwa has been issued in accordance with the government's decision to observe the lockdown and contain the spread of coronavirus. The ulema and muftis from Jamia Nizamiya appeal to Muslim community to follow advices of health experts, observe preventive measures and maintain social distancing. The Telangana State Waqf Board, citing the Jamia Nizamiya's decision, asked the custodians of Waqf properties to prevent any congregations during Ramzan until further orders. Lakshmi, AR News, Hyderabad.
Maharashtra Minority Affairs Minister Nawab Malik urged people not to gather in basements, parking areas or any other place to offer prayers during Ramzan, saying that social distancing is the need of the hour. In a tweet, Malik urged the community members to contribute in the best possible way and to fight this challenge together. He also appealed to the community members not to violate lockdown rules. The administration has made it clear that seeing the grave condition in the state due to the rising of COVID-19 cases, there is no scope for relaxing the lockdown because of Ramzan. The holy month of Ramzan starts today.
State Health Minister Rajesh Tope said the Maharashtra government will push for aggressive tests to detect coronavirus and also increase facilities for institutional quarantine as home isolation is not working. Speaking on the mortality rate from the virus, which had now come down to 4.4%, Tope said the number of cases is more because of early detection. He said that the government also wants to increase the span in which cases double. In an over initiative, a taluka administration in Maharashtra has set an example of how an innovative thinking can ease people's lives in the current challenging situation arising out of the threat from the coronavirus outbreak. The local administration in Patur near Akola district of Vidarbha region of Maharashtra has come out with a unique idea of providing diesel to farmers at their doorsteps by a mobile diesel van. Thus, the local administration has roped a taluka-based petrol pump dealer to cater to the need of fuel, which is daily requirement of the farmers for their farming machinery. District Collector Jitendra Papalkar said to avail this facility, a farmer has to just make a phone call and inform of his requirement. He informed that the service is available even in remotest areas of the region, besides villages like Malsure, Igras, Patur, etc. With Madhu Kasbe, Devopriya Bhattacharjee, EIR News, Mumbai.
In our series Experts Speak on All India Radio, we bring you the views of some leading medical experts on COVID-19. Talking to AIR News, President of Public Health Foundation of India, Dr. K. Srinath Reddy said, India is in a much better position as compared to rest of the world as far as the COVID-19 cases are concerned, and the measures taken are showing results.
We started getting affected later than many other countries, but we are presently in a much better position than the rest of the world, and in that sense, we are better protected. However, we still have to watch how the epidemic advances over the next weeks before we can come to a judgment. But right now, it appears that our measures taken progressively from February and peaking with the lockdown are now paying dividends and showing results.
Talking to AIR News, Director AIMS, Dr. Randeep Guleria advised the people, and especially to those in the hotspot zones, to sincerely follow lockdown measures to break the chain of transmission of COVID-19 infection.
If we observe this lockdown in a sincere manner, we will be able to break the chain of spread and we will be able to bring down cases and be able to prevent deaths and conquer corona in India. I would also request all citizens to observe social distancing, regular hand washing, and I would also say that we should try and support people because this is a time of hardship as far as people of the low socioeconomic status are concerned, and also be able to support and encourage the doctors, the healthcare professionals who are fighting at the front line against this pandemic.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion on COVID-19. Dr. Avdesh Sharma, an eminent psychiatrist and consultant, will participate in the discussion. Listeners can ask questions related to stress, anxiety and depression during the COVID-19 pandemic on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
Amid the coronavirus pandemic, AIR correspondents spoke to people about the benefits they have availed under various central government schemes. Najma Khatun from Begusarai, Bihar said that the government has done a lot for poor by providing help under the Prime Minister Garib Kalyan and Ujjwala Yojana.
मोदी सरकार जो दी है ना, फ्री गैस दी है ना, फ्री वाला राशन मिल रहा है. हम लोग के लिए मोदी सरकार बहुत धन्यवाद है, बहुत बहुत हम लोग का सेवा कर रहे हैं.
Kundan Lal Sahu from Mahasarnod district of Chhattisgarh has got money in his account under the Prime Minister Kisan Samman Nidhi. He said it will help him in farming.
मुझे लॉकडाउन के दौरान जो केंद्र सरकार से अभी राशि किसानों को सहयोग के रूप में मिला है, उससे किसानी के कार्य करने में सुविधा होगी. प्लस कुछ लोगों का ऐसा है कि जिनको तकलीफ है, उनकी तकलीफ को भी देखते हुए सरकार ने जो सहयोग किया है, उसके लिए मैं केंद्र सरकार का, मोदी जी का बहुत बहुत आभारी हूँ.
Shashi Bhushan Prasad from Jamui, Bihar expressed gratitude for receiving food grain.
मेरा नाम शशि भूषण प्रसाद, ग्राम सुगी, थाना व जिला जम्मू का निवासी हूँ. प्रत्येक महीना जो सस्ता दर से अनाज मिलता था वो मिला. इसके अलावा मेरा 6 यूनिट है, 30 किलो अनाज फ्री मिला, जिससे मेरा परिवार आनंदपूर्वक खा पी रहा है. इसलिए मैं प्रधानमंत्री को धन्यवाद देता हूँ.
There is a silver lining with statistics showing that the percentage of cured patients from coronavirus is improving day by day. A total confirmed cases of coronavirus infected persons across the country have reached to 24,506, with the numbers continuously on the rise. Out of these, 5,062 people have been cured or discharged and one had migrated. Our correspondent reports that on the 25th of March, exactly 1 month before, when the lockdown was enforced across India, 43 patients were cured of the deadly coronavirus infection, which was 7% of the total 606 cases. The figure has now reached to 20.66% over the last 1 month. Health and Family Welfare Ministry data reveals that in Arunachal Pradesh, Goa and Manipur, all patients were cured. Lifeline Udan has till now transported 649 tons of supplies on 368 flights. It has flown across 3,63,819 kilometers. Civil Aviation Minister Hardeep Singh Puri said in a tweet that our robust civil aviation infrastructure is working round the clock to ensure timely transport of life-saving medical supplies to regions where they are needed.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. A rumor has been circulating on the messaging app WhatsApp saying that the government has ordered closing of all hotels and restaurants till the 15th of October 2020. The Ministry of Tourism has denied any such order and has asked people to disregard this message. The ministry said that the matter is now under investigation by the Cybercrime Unit of the Mumbai Police. A tweet has been circulating on social media saying that the Indian Council of Medical Research may do a study on the immunity of indigenous Assamese persons to COVID-19. The tweet says that no person of such descent has been found corona positive. PIB Fact Check has debunked the rumor in a tweet, quoting Dr. Balram Bhargav, DG ICMR, saying that there are no such studies at the moment. World Malaria Day is being observed today. It is an international observance commemorated every year on the 25th of April to recognize global efforts to control malaria. The Health Ministry has asked everybody to take a pledge to beat malaria with a list of simple methods to further the campaign of Zero Malaria Starts With Me. Malaria is transmitted by the bite of infected female Anopheles mosquito. The ministry has asked people to stay protected and to use insect repellent, wear long-sleeve clothing, fit homes with wire mesh, and clean places around their homes where mosquitoes may breed.
A total of 138 new confirmed cases of novel coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 2,514. Delhi government has confirmed that 857 patients have been cured and discharged so far, and 53 deaths have been reported in the national capital. A total of 3,112 tests were conducted yesterday. Overall, 33,672 tests have been conducted so far. In Haryana, 5 new confirmed positive cases, 4 from Sonipat and 1 from Panipat reported today, according to media bulletin issued by the Health Department in the afternoon. With this, the number of corona-positive patients cured so far has risen to 280, which includes 24 foreign nationals and 64 from other states. In the state, 3 deaths reported till now, and state is left with 90 COVID-19 active patients now. Till now, 186 patients have cured and discharged from hospitals.
The Assam government has launched a new scheme, Dhanvantari, under which locally unavailable medicines are provided to patients at home. Health Minister Mr. Himanta Biswa Sarma said that medicines below 200 rupees will be provided free of cost to patients. He said that health workers are delivering medicines for patients who cannot get it within 10 kilometers of their radius. In Bihar, the number of positive cases of coronavirus have mounted to 223. Maximum cases were reported from Munger, where 31 people tested positive, while the youngest to have positive is a 14-month-old girl child. So far, 45 people have recovered and 2 have died, taking the total number of active cases to 176 in Bihar. Chief Minister Nitish Kumar instructed to ensure immediately tracing of the chain of all positive cases and quarantine all suspected people. Mr. Kumar asked concerned authorities for sanitizing all hotspots and neighbouring places to break the COVID chain.
The state government will bring back the labourers of Madhya Pradesh stranded in other states due to the lockdown. Necessary action is being taken in this connection. Chief Minister Shivraj Singh Chauhan also discussed the matter in detail with the Chief Ministers of Uttar Pradesh, Rajasthan, Gujarat and Maharashtra. They also assured full cooperation. More in this report.
Around 1,10,000 labourers of Madhya Pradesh are stranded in other states. Maximum 35,000 labourers are stranded in various cities including Ahmedabad, Surat and Vadodara in Gujarat. The Chief Minister said that family members of the labourers stranded in other states will be permitted to go from Madhya Pradesh to bring them back. Simultaneously, labourers from other states stranded in Madhya Pradesh will also be permitted to go back to their states. The workers stranded within Madhya Pradesh will be allowed to travel back to their home districts. The Chief Minister directed the officials of concerned department to complete all arrangements in this regard so that labourers do not face any problem. Officials clarified that no labourers will be allowed to move from the infected areas of the state. Sanjeev Sharma, AIR News, Bhopal.
At least 61 corona-positive cases have been recorded in Andhra Pradesh as of now. The corona-positive cases have gone up to 1,016 as against 955 yesterday. At least 61 positive cases have been recorded during the past 24 hours as per the health bulletin of the state government. Of the total 1,016 cases, 171 patients got recovered and successfully discharged from various places in the Andhra Pradesh state, while 841 persons are under treatment across the state in various hospitals.
As Kerala continues to flatten the COVID-19 infection curve, the government plans to implement reverse quarantine in the state. A report.
Reverse quarantine is a practice of detaching the most vulnerable people, aged or people with comorbidity conditions from the rest, and to monitor their health indicators closely to protect them from infection. The government is working on it as part of its multi-pronged strategy against COVID-19. Through this, in case of a community spread, it can isolate the large volume of the grey population and check their mortality rate effectively, unlike what occurred in some of the Western countries. According to expert opinion, only reverse quarantine is effective until half of the population recovers from COVID-19 and gains immunity.
And now, before we end the bulletin, the headlines once again. 4 new interministerial central teams reach Hyderabad, Chennai, Ahmedabad and Surat to make on-the-spot assessment of COVID-19 situation. Government allows reopening of all shops excluding malls in non-hotspot areas. Government declares banking industry as public utility service till 21st of October. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. Sanjay Kothari takes over as Central Vigilance Commissioner, and first day of holy month of Ramzan observed all over the country. And with that, we end the midday news.